Joined live once again with Dr. Dana Hawkinson, University of Kansas Health System. Doctor, again, thank you for your time this morning. So in your medical opinion, how should Missouri and Kansas leaders approach making a plan to reopen the economy? We know you're not an elected official, but from a medical standpoint, what's the best way to look at this?
Yeah, we talked about in the last segment, I really think we need to make sure that the prevalence of the disease is low in our community. Certainly Governor Kelly and Dr. Norman have done a very good job about trying to keep the public informed. Dr. Lucas on the Missouri side, Mayor Lucas on the Missouri side has done a really good job of keeping, ahead of the curve for that. We need to do it in a methodical method. We need to make sure that we keep our first responders healthy, our firefighters, our police, the people that protect us, our EMS. So we need to make sure that it's as low as we possibly can get it, so that when we do open up and we do have more people interacting with each other, we don't reach an exponential spread and get those people ill and start to overwhelm our healthcare system. It's a very difficult question to answer. I'm glad I don't have to be the one answering that, but I know that those people have the best minds helping them do that, and it should be probably a tiered and a staged thing so that we can start to get the economy back, but again, doing it in the right way, again, also to protect the most amount of people as well.
Doctor, one of the CDC's guidelines to reopening is a focus on personal responsibility to prevent exposure to other people. How can we make sure we're being responsible? I'm just thinking about my own trip to the grocery store last night. You have to be focused the entire time yourself just to try to not accidentally get in someone else's space. I really put it bluntly for us here. How vigilant do we need to be, and for how long?
Yeah, we certainly value personal freedom here in America. We value personal responsibility as well, but sometimes that doesn't always occur in a lot of individuals. As you stated, going to the grocery store is pretty easy. Most people are staying away from each other. At the park, it's pretty easy. You're able to stay away from each other. But as you get into other things, such as maybe restaurants or bars or other areas where people can congregate and have the potential to be closer, that's when it becomes a problem. I think the first thing is not going out if you know that you're sick. You can certainly wear a face mask as well, even if you're not having symptoms. That's certainly recommended, not mandatory. That will help the spread. Also, personal responsibility of using adequate and frequent hand hygiene with either hand washing, soap and water, or alcohol gels. And most vitally important, even if you have a face mask on, and especially if you have a face mask on, not putting your hands around your face, because as you're out in those areas touching high touch surfaces, looking at other products, and then touching your face or manipulating your face mask, that is going to put you at highest risk of getting coronavirus. And then if you are ill or have a cough or sneeze, obviously cough or sneeze into your elbow. So those are the main things that you can do for personal responsibility and vigilance.
Last question for you this morning, Dr. Hawkinson. We're throwing a lot of political questions at you, and we apologize for that. But one of the big news stories this morning is the president last night tweeting about immigration being halted now moving forward. I guess the question we want to ask you here is, how important are borders, I guess, moving forward as far as stopping the spread of the disease? Because we've seen other nations all around the world have different instances of it, some more than others. How important are trying to keep things closed off from one another right now?
Yeah. My humble opinion, I don't think borders matter. We've already seen that this infection jumps oceans, it jumps countries, it jumps over mountain ranges. I don't think that it matters too much. I think as much as we can in the context of stay at home and self-isolation, self-quarantine, social distancing, I think in that context, it's obviously going to be a very good thing and helpful thing. And if we can prevent as much of other people, even our citizens, from doing that, that would be good as well. We're trying to take all the measures that we can, but again, in the context of social distancing and stay-at-home orders, I think that would be a good thing and a fine thing to try. It'd just be a matter of logistically, can that occur? And so that's the big issue there. But without trying to get too otherwise political, I think overall in the context of social distancing and physical distancing, that would be, that might help a little bit. But we know this virus can jump oceans, continents, all those things.
Right. Dr. Hawkinson, thank you so much for joining us.
Doctor, thank you so much for joining us this morning.